This is the first follow-along workout routine. So pay really close attention to how we're doing the exercises and not overstraining or overstressing your body. You'll know when you're ready to move on to the second routine when you can perform this entire routine without your back coming off the floor, without feeling the need to strain at the neck, and without lifting your shoulders or neck off of the floor. It's best to do this first routine 3 or more times a week so you can start to really train that coordination of how to hold your trunk together and how to pressurize your stomach properly. All right, welcome to level 1 exercise routine. Just follow along. We're going to start out with blowing out the candle. So everyone lie down on the floor, knees bent up with your feet flat, and you're just going to take a second and let yourself relax. Let your spine relax into the floor. Let your neck muscles go. Don't arch your back. Don't try to hold a neutral spine. Just let everything go. Arms are just going to rest down on the ground. And you're going to take a gentle breath in and then blow out in one steady blow like you're blowing out the candles on a birthday cake. As you blow out and as you get to the bottom of that breath, you're going to notice that your ribs begin to drop. And that's exactly what should be happening. Don't try to force them to go down, and don't pinch your stomach closed. One more time. Gentle breath in, and then blow out. One steady blow. Feel the ribs dropping. Good. I'm gonna walk around, see how you guys are doing. Keep it nice and steady, blowing out. Don't pinch in the stomach. Really nice, really good to get those ribs to drop. Deep breath in, good. And then again, blow out gently, easily. Don't force it. Don't squeeze your abdominals. Good job. Breathe in and blow all the way out. Let those ribs drop. Very good. Very good. Nice job. How you doing back there, Dustin? Excellent job. Dustin is doing a very good job at making sure those ribs come down. As the ribs come down, you can see the stomach comes up a little bit. It's exactly what we want to see happen. The ribs are dropping down and becoming parallel to the pelvis. And just hold that breath out for a second. See if you can keep the ribs down. And if you need to breathe in again, that's fine, but make sure the breath happens in the stomach only and the ribs don't come back up. Perfect job. Perfect job. All right, and relax. And we'll do the same thing a couple more times. Blowing out. Feel those ribs drop. Don't hold on to them. Let them relax. One last time. Blow out. Feel the ribs drop. Really good. All right, from here we're going to move right into the elevator exercise. So make sure again that your back is relaxed, your body's relaxed. You're going to take your fingers and place them just inside your pelvis and below your belly button. Okay? From here, without using your breath, you're just going to push your fingers up like your stomach is an elevator, pushing the people to the 10th floor of a 10-story building. Hold them up there for a second or two, and then you're just going to let them go. And again, push up, and let go. Push up. And let go. Keep practicing. You should be noticing that as you push up, that your chest naturally drops, just like it did with the candles. Really nice job. Push. Good job. Excellent job. Everyone's doing really well. So I want you to push and try to hold them there for a second, maybe 3 to 5 seconds. Push and hold. Hold it up there. Maintain that pressure. Feel how you just created pressure down in your lower abdominals. Really good. And relax. And repeat. So this elevator exercise where we create that pressure in the abdomen, we're going to use throughout the entire rest of the routine and all the future routines. It's really important to master that skill. So this next exercise, we're going to incorporate our arms. So we're starting with the elevator. So push that elevator up, but instead of going to the 10th floor, this time I just want you to go to the 5th floor. So you're going to give about 50% of the force that you were doing before. And you're going to hold the elevator at the 5th floor, and you're going to lift your hands so they're pointing toward the ceiling. Good. Keeping the shoulders relaxed to the floor. Your elbows should be loose. They should not be rigid. Hands should be loose as well, not rigid. Keeping the pressure at 50% in your stomach. Then you're going to let the arms come up over your head without the ribs lifting. And you're going to return them back to the ceiling. And hold the pressure, and arms go back. Don't let the ribs come up. It's tricky to coordinate. Back to the ceiling. And again, over your head. Back to the ceiling. Walk around, take a look, make sure everyone's keeping those ribs down. How you doing back here, Dustin? Good job. Keep those ribs down. Perfect. Elevator at 50%. Only bring the arms back as far as you can without letting the chest come up. So as you go back, if you go too far, the chest is going to come up. And so we want you to maintain that proper alignment in your trunk. Here, go ahead, let the arms come back. Only as far as you can go, keeping the ribs down. Perfect job. And repeat this. We're starting to let your body get used to that coordination, changing the way the body relates to itself. Very good job. Excellent. Good. Very good job. Holding that pressure the whole time. Go back one more time with the arms. Perfect. All right, everyone's doing great. You can relax that pressure in your stomach. Give yourself a break for a second. Good. And now we're going to move on to the legs. So with this exercise, you're going to create that pressure in the stomach by pushing the elevator to the 5th floor. Good. And you're going to lift one leg up. And as you lift your leg, we want that knee to move slightly out to the side. We don't want the knee to be pointing toward the chest, slightly outside the shoulder. Keeping the pressure, and then we're going to lower it down. And we're going to repeat it on the other side. Lift the other leg, keeping the pressure, keeping that elevator, allowing the ribs to stay in place, and then come back down. Really nice. Very good. Nice job, Dustin. Good. A couple more times each side. Keeping those ribs down. Perfect. Good. Right to about here. Good. And then let it down. One more time each side. Good. Excellent. Bring the legs down, but keep the pressure, and we're gonna move right into the second exercise. So keep that pressure, lift one knee up, and I want you to hold it suspended there. Keep the pressure in the stomach and the ribs down, and then you're gonna lift the other knee without losing that pressure. You should not allow your ribs to come up. You shouldn't allow your back to arch away from the floor, and just hold right there. Hold it right there, keeping the pressure out. Very nice job. Now one foot comes down, keeping the pressure. Don't let the ribs come up. And then the other leg goes down. Very good. And one leg comes up. And the other leg. Good. One more time. One leg down. And one more time. Up with one. Up with the other. Good. And then down with one. Down with the other. And relax. Good. All right, next exercise, we're going to work on moving our head. Again, keeping the pressure. So we're going to maintain the pressure in our stomach, bring that elevator to the 5th floor, make sure the ribs stay down. And this time, instead of moving our arms or our legs, we're going to elongate our neck and barely lift our head up off the floor by tilting our nose down. Our ribs need to stay in place. Pressure needs to be maintained in our stomach. And then lower. Pressure in the stomach, elongate the neck, lift the head. Lower the head back down. Good. This is a tricky exercise. Really important to maintain this coordination. A lot of times it's easy that once we try to lift our head and the task is very difficult, we lose our ribs and we let our ribs flare back up. Go back down. Good. So we really need to concentrate. It's about getting that elevator to the right position, which is going to maintain our ribs in the right position, and then lift the head on top of that. Perfect job. See how she tilted her nose down to maintain that alignment. Very good job. Let it down. This is a tough one, so let's just do a couple more before we do our last exercise. Very good job. All right, heads down. We're going to go back to our starting position. We're going to generate the pressure in our stomach, so we're going to go to the 5th floor with that elevator. We're going to lift our arms up so they're pointing to the ceiling. We're going to lift one leg up, lift the other leg up. This position is called the 3-month position because when we're 3 months old, this is what we should be able to do. This is what 3 months are able to do in terms of holding their trunk in control and bringing their legs and their arms into the picture. So from this position, we're just going to roll side to side. So we're going to start by going to the right, quarter turn, keeping the arms and the legs at the same position as we roll, and then roll onto the back, and then roll the other direction, holding, keeping the pressure onto the back. Good, nice and slow and controlled. Go roll the other direction. Let's go to the side. Very good. Onto your back. To the side. Keeping the pressure. Ribs staying down. Very good. Relax the elbows just a hair. Good. Good. We're trying to put all the work into the middle and not in our fingers or our arms. Roll to the other side. Good. Really good. Hard. It's very normal to wiggle, to try to find that middle. You don't want to roll so far that you feel your back arching or your ribs flaring up. That just means you rolled too far. Really focus on keeping in control, one step at a time. Very good. Maintain the pressure. If you're wiggling too much, make sure to maintain that pressure. That's going to help reduce the wiggling. Okay, one more time each side. Good, onto your back. And then go to the other side. Really nice job. Onto your back. And relax. Excellent. That's it for the first routine. Practice this at least 3 times a week to really build up those coordination skills, build your control, build your awareness of your middle so you know when you're making mistakes. And when you're able to do all of this without letting your back come up and do this proficiently, you'll be ready for level 2.